Okay, so we are going to be drawing blood now from the port. Since I was already with Mr. Smith here, I don't have to verify his name and date of birth with him again. But if you were just first coming in, obviously you want to verify his name, date of birth, allergies. You want to assess the site again, making sure that everything is good, there's no redness, and no type of infection that you can see. So I'm just going to start by sanitizing my hands. And I'm just going to put on clean gloves so we don't have to do sterile gloves at the moment. Now, before I put on my gloves, I'd want to make sure I have all of my supplies, which I already do. I have my empty, sterile 10cc syringe, which I'm going to collect my blood in, and I have 3 10 mLs or cc flushes. Okay, so now that I have that all set, I can go ahead and put my gloves on. I'm just going to first start by cleaning the PosiFlow here for 15 seconds. And I just tell Mr. Smith why I'm drawing up his blood, what I'm doing. Alright. So, we can go ahead and take our first flush. I already primed these, so I don't have to worry about it. So I can go ahead, take it off, connect it. You want to follow your agency's policy too. I'm going to do the full 10 cc's, and I'm also going to look for a blood return first too. Make sure that everything's unclamped here. So push a little bit. We're going to use the push-pause method, looking for that blood return, which I have. Perfect. And then we can go ahead in with the full 10 cc's here. Okay, so now since I do need a discard blood draw, I'm just gonna go ahead and use this right away. So my agency wants me to do 5 cc's, so I'm gonna go ahead and I'm gonna get 7 just in case there's something wrong with the blood. If we were drawing back light and really thin blood, that probably means that we're drawing back something that was already in the port from the last infusion. So we really want that bright red, thick blood for a good sample. So I'm just gonna go ahead and use this. You can see we're getting good blood return. Alright, so I have my blood. Go ahead, twist it off, and I'm just gonna set this aside. And we're gonna alcohol it off again for 15 seconds. If I can hold on to it, there we go. Also gonna clamp too. That's a good idea. All right. So I'm gonna go in with my actual sample here. I do have this open, so I can just go ahead and slide this out. Again, my agency wants 5 cc's, so I'm gonna draw back 7. Go ahead and remember to unclamp. Now this is gonna be the good blood sample. Perfect. can go ahead and clamp, twist this off, and I'm actually just going to put this right back in the little container it came in, so I know this is the good blood sample. Alcohol off again. My goodness, I cannot get this out. There we go. And another 15 seconds. It's really squeaky. Means it's super clean. Okay. And then every facility policy is different. Mine is for 20 cc's, and you just follow it. So I'm going to do the 20 cc flush. Put this up. Remember to unclamp. Push pause. Perfect. Clamp again. Jeez. These gloves are too big for my hands. And lastly, alcohol it off again. 15 seconds. Okay, and then my last 10 cc flush. Unclamp. And push pause. Okay, well, my thing is really full, so I'm just going to pretend that I injected the 10 cc's. Go ahead and clamp it again. Twist off, alcohol off again, and again, I'm just going to keep his locked because he wasn't up to a running infusion. If you were on a running infusion, you could go ahead and just connect it again now that everything is sterilized, and start the infusion again. Okay, good. And then make sure, obviously, if you connected your infusion, to unclamp. So, yes, it's very full. What I would do next is I'd make sure that I would label the blood with the patient's name. Most facilities do have a label for you. I could hook this up to an adapter, and it would go into the blood test tube for you right away, but we don't have that here. So just for this purpose, I'm just going to leave it in this bag and take it to the lab with the patient's sticker on there. And then I would just go ahead and document everything, and that's it.